Today, we will be diving into the complex and multifaceted topic of Prader-Willi syndrome, PWS. Prader-Willi syndrome is a rare genetic disorder with distinct clinical manifestations and diagnostic criteria. This syndrome poses significant challenges to individuals, their families, and healthcare professionals due to its various medical, cognitive, and behavioral features. Throughout this lesson, we will explore the genetic etiology, clinical manifestations, diagnostic criteria, growth hormone deficiency, cognitive and behavioral phenotypes, neuroendocrinology, management strategies, sleep disorders, psychiatric manifestations, neuroimaging findings, multidisciplinary treatment approaches, long-term outcomes, and current research in Prader-Willi syndrome. By the end of this session, you will have a comprehensive understanding of this syndrome and the latest advancements in its management. So let's begin our journey into the world of Prader-Willi syndrome. Prader-Willi syndrome is typically caused by a deletion of the paternal chromosome 15q11q13 region, involving multiple genes, including SNRPN and NDN. In some cases, PWS may result from maternal uniparental disomy 15, UPD, or imprinting defects. The genetic abnormality in PWS leads to the characteristic features and challenges associated with this syndrome. Understanding the underlying genetic etiology is crucial for accurate diagnosis and management strategies. The clinical manifestations of Prader-Willi syndrome are diverse and evolve over time. Newborns with PWS may exhibit hypotonia, feeding difficulties, and poor weight gain. As they grow older, children with PWS develop hyperphagia and an obsession with food, leading to severe obesity if not managed appropriately. Other common features include short stature, hypogonadism, intellectual disability, behavioral problems, and distinct facial features. Accurate diagnosis relies on recognizing these clinical manifestations and adhering to specific diagnostic criteria. Growth hormone deficiency, GHD, is a prominent endocrine abnormality seen in Prader-Willi syndrome. GHD contributes to short stature and poor growth in affected individuals. Early detection and treatment with recombinant growth hormone therapy have shown to improve growth parameters and body composition, positively impacting the overall well-being of individuals with PWS. Cognitive impairments are common in Prader-Willi syndrome, with most individuals falling within the mild to moderate intellectual disability range. These cognitive deficits affect various domains, including language skills, executive functions, and visuospatial abilities. Additionally, behavioral phenotypes, such as stubbornness, temper outbursts, and obsessive-compulsive tendencies, further challenge individuals with PWS and their caregivers. Understanding these cognitive and behavioral features is essential for tailored interventions and support. The neuroendocrinology of Prader-Willi syndrome involves dysregulation of various hormonal systems, including the hypothalamic pituitary axis and various neuropeptides. The imbalance of hormones, such as leptin and ghrelin, contributes to the hyperphagic behavior and abnormal satiety regulation seen in PWS. Furthermore, disturbances in sex hormone levels, cortisol secretion, and oxytocin pathways further compound the challenges faced by individuals with PWS. Understanding these neuroendocrine abnormalities is crucial for targeted interventions and management. The management of hyperphagia and obesity is a key aspect of Prader-Willi syndrome care. Several multidimensional approaches, such as structured eating plans, environmental modifications, and behavioral interventions, are utilized to manage the intense food-seeking behavior and prevent the life-threatening complications associated with obesity in individuals with PWS. Moreover, the judicious use of appetite-suppressing medications and bariatric surgery may be considered in selected cases. Sleep disturbances are prevalent in individuals with Prader-Willi syndrome and have significant implications for their overall well-being. Sleep-disordered breathing, including obstructive sleep apnea, is commonly observed in this population due to obesity, hypotonia, and craniofacial abnormalities. Moreover, individuals with PWS may experience excessive daytime sleepiness, restless leg syndrome, and behavioral insomnia, further adding to the burden of this syndrome. Recognizing and effectively managing sleep disorders is essential to optimize the quality of life for individuals with PWS. Prader-Willi syndrome is associated with various psychiatric comorbidities that further contribute to the complex clinical presentation of this syndrome. Conditions such as autism spectrum disorder, obsessive-compulsive disorder, mood disorders, and psychosis are more prevalent in individuals with PWS compared to the general population. Thorough psychiatric evaluation and targeted interventions are crucial to address the psychiatric needs of individuals with PWS and improve overall functioning. Neuroimaging studies in Prader-Willi syndrome have provided valuable insights into the neural substrates underlying the cognitive and behavioral phenotypes observed in this disorder. Magnetic resonance imaging, MRI, Studies have revealed structural abnormalities in the hypothalamus, amygdala, and prefrontal cortex, which may explain the hormonal dysregulation, cognitive impairments, and behavioral deficits seen in PWS. Understanding these neuroimaging findings enhances our understanding of the pathophysiology and potential therapeutic targets in PWS. Prader-Willi syndrome necessitates a multidisciplinary approach to address its diverse medical, developmental, and behavioral challenges. A collaborative team comprising pediatricians, endocrinologists, geneticists, neurologists, psychologists, dietitians, and therapists work together to provide comprehensive care for individuals with PWS. Coordinated interventions, including specialized educational programs, behavioral therapies, medical treatments, and psychosocial support, are crucial for optimizing outcomes and enhancing the quality of life for individuals with PWS. Long-term outcomes in Prader-Willi syndrome vary considerably and depend on various factors, including early diagnosis, timely intervention, and ongoing support. With appropriate management strategies, individuals with PWS can achieve improved growth parameters, reduced obesity, enhanced cognitive and adaptive skills, and better overall functioning. However, challenges persist, particularly in the areas of weight control, behavioral management, and social integration. Understanding the long-term outcomes helps guide treatment planning and set realistic expectations for individuals with PWS and their families. Prader-Willi syndrome remains an active area of research, with ongoing studies focused on elucidating the underlying pathophysiology, discovering novel therapeutic targets, and developing innovative interventions. Research efforts include investigating genetic modifiers, exploring the role of epigenetics, assessing potential pharmacological interventions, and implementing neurobehavioral therapies. The ultimate goal is to further our understanding of PWS and improve the outcomes and quality of life for individuals affected by this syndrome. In conclusion, Prader-Willi syndrome is a complex genetic disorder with a broad spectrum of clinical manifestations and challenges. Its intricate interplay between genetic, hormonal, and neurobehavioral factors necessitates a comprehensive and multidisciplinary approach to diagnosis and management. Through the integration of genetic testing, clinical assessments, hormonal interventions, behavioral therapies, and ongoing supportive care, individuals with PWS can achieve improved outcomes and enhanced quality of life. As advancements continue to unfold, it is crucial for healthcare professionals to remain current and contribute to the ongoing research effort aimed at unraveling the mysteries surrounding Prader-Willi syndrome.